That said, this session is going to be great. I'm so pleased to have Jonathan and Fay here with me. They are, I would say, maybe the power couple of digital health care innovation, or given Jonathan's family name, you might call them the first family of digital healthcare innovation. And he is one of those bushes, but we're not going to get into that. So Fay Rotenberg is CEO of Firefly Health, and Jonathan is the executive chairman of it also. They're married, just so in case you didn't pick that up. And Firefly Health describes itself as half-priced healthcare that is twice as good clinically and emotionally. So that's very cool. Jonathan Bush, who was, as we heard earlier, the founder of Athena Health, is currently working as the founder and CEO of Zeus Health, which is a shared development platform backed by a shared data record for digital healthcare startups. So whereas Athena Health was attempting to sort of intervene with the healthcare ecosystem, now he's trying to facilitate the healthcare innovation ecosystem. So I really love that. I love that they've agreed to speak here together, which is not a standard thing for them. Have you done this before?
No.
They've never done this before. So that's what you get when you do Techonomy CDX.
There's a real chance that this is the only time.
Well, I hope it's so great for us that it's bad for you. But anyway, I wanted to start by asking both of you, where are we headed with healthcare?
Yeah. In general, I feel like with healthcare, we're headed where we're headed everywhere in the world, only way more slowly. So in the world, we're digitizing. We're digitizing science, we're digitizing research, we're digitizing banking and transportation, and I think we are digitizing healthcare. We're just, in the early days. And that is one of the things that excites me about Firefly, is that they've gotten such a good sort of grok on the first wave, which is, I think, the ability to have an always-on, sort of instantly available version of healthcare for people. That was not there pre-pandemic in a meaningful way. I think McKinsey published a big study, poor guys, like 12 seconds before the pandemic, that said up to 18% of care delivery could happen virtually over the next 10 years. And then 7 seconds after they hit send, 99% of care delivery happened virtually for 2 years. Not their fault. But that's the way I see it. I see where healthcare is heading is that which was analog is increasingly digital, and because of good reasons, safety net reasons, Hippocratic Oath reasons, in healthcare it's more slow.
Okay, Fay.
Yeah, I agree, but I'd take it a step further. I think that we have gone through what I agree with is the first wave of digitization in healthcare, which has really been about convenience. It's been about essentially virtualizing what happens physically. So do a virtual visit without actually rethinking the way that care is delivered. And I think that step 2 is actually fundamentally rethinking the way that care is delivered and actually thinking about value. So moving from, if you think of step 1, wave 1 as convenience, which is important, step 2 is about value. So how do you actually restructure the way that care is delivered virtually to deliver more value? I believe that step 3 is actually about then that value that you're delivering, create a mechanism to be able to pass that back to individual consumers.
So just quickly describe specifically what a Firefly patient, client, member experiences that they couldn't have gotten before.
So Firefly started as virtual first primary care. So you have basically an interdisciplinary dedicated care team. It includes primary care physician, nurse practitioner, behavioral health specialist, health guide, basically always on team that can handle all of your ongoing care needs. We then began to build out more of a specialist network, integrated physical facility partners, health systems, other virtual specialty care partners, incorporated that. And then the last step for us is this past year, we built a health plan around our care delivery. So we're now a virtual first health plan. And again, I think that the logic I described around the way that I see healthcare is moving, it tracks to Firefly's development. Because one of the big reasons for us creating a plan was creating that mechanism to actually pass back the value we were delivering and the savings we were seeing back to employers, back to individual members.
And it's generally distributed by partnership with employers.
Through employers. So we have partners with some health plan, with a large health plan in Massachusetts, and we sell the plan to employers.
Right. individuals can join, but only in Massachusetts and Maine, I discovered.
We're not allowed to use the
And not for Medicare.
the largest health plan whose name rhymes with ass, right?
We have a BCBS Massachusetts partnership, but otherwise we're focused on selling to employers.
So the thing that's encouraging is that you're both saying we're actually going to get to this chimerical world of digitally facilitated healthcare, which today I've been listening to a lot of great talks from the stage, but a lot of it sounds complicated. A lot of it seems like there's a lot of impedance.
Yep.
And even, we heard from the Office of the National Coordinator for Health Information Technology, Ryan, whatever, I forget the last name, but I was listening to her and thinking, oh man, that sounds really, really hard.
Yeah. Well, that's right. And I think whenever we try to do a moonshot, it's a messy thing,
Yeah.
right? And if it's an existential threat and we need a nuclear bomb, maybe we get there. But otherwise, it's just an incredibly wasteful way to do things. You need some sort of gravitational pull that allows disorganized entities all over the place to do their own wiggling and waggling and moving, the bee signals towards the honey. And most of the world, that's the market. That's the demand curve. Healthcare has a pretty weak demand curve. It's in there somewhere. What I like about what Firefly and a lot of the leaders have done is if they've sort of cheated the demand curve for a minute and said, well, why don't I get started on the convenience curve? Why don't I just say, like the urgent cares did and like the retail clinics did, say, it happens to be a lot cheaper, but I can't figure out how to make that money for you. So anyway, we have no wait time. How about you come here first, right? And Firefly took that to 11 and said, our wait time is in minutes instantaneously whenever you feel like it. Now, eventually, Firefly's got this plan, and all these digital health companies eventually have to sort of puncture in to the resistant world that Mickey Tripathi and the government, the hospitals, and those who still sort of think of their data as precious, the ring to rule them all, and no one can have it, and I'm going to license it to you, and all this kind of creepy pharma conferences where. It's de-identified, but I know. That shit's really hard.
Yeah.
But if so in Firefly, that sort of you start with the early days, and the birds are chirping, and everybody's happy, and good morning, Mr. Robin. Like everyone just loves their care. Their Net Promoter Score literally is a 79. I didn't believe it. We redo it every month. It's always in that range. But then all of a sudden you need a specialist, right? Then all of a sudden you need a surgery, and somebody drags the beautiful needle across the Disney music, and now you're, I'm gonna fax the thing, and then gotta get the authorization. And
where's Jim? No more faxing, right?
But that move across the line is where we are right now. Is can we puncture that through that? Is there a common data layer? Is there a coalition of the willing that includes some of those established medicine providers like a Cedars and others that sort of say, look, we're rich enough to do the right thing here and be forward leaning. And I think that's where the battlefront sort of currently sits.
Okay, Fay, I'm curious, the pandemic, as Jonathan said, suddenly everybody understood virtual healthcare mattered. How much has that sort of given a sort of supercharge to the work you guys are doing?
I think it's certainly given a supercharge in the fact that a lot of people didn't believe previously that you could actually receive high-value care virtually. I think at this point, most people recognize that's possible. It's also created a lot of noise in the market. There are many, many companies that claim to be, virtual primary care, virtual this. I could argue that many of them are not actually virtual primary care. It's really virtual urgent care. It's just virtual visits, and I think that there is a real difference. So I think that's created a lot of noise, but it's also created acceptance.
That's great. Jonathan, explain what Zeus is doing, and why did you start it?
Zeus is the homework that the dog ate while I was at Athena. So it's the thing that we were spending too much money on, and the shareholders could get restless on, which was it was what I thought would be the next growth curve for Athena would be servicing an application-oriented, a new sort of phenotype of company that could code and deliver care under the same roof. Right. And I thought that this, while very small, would explode, and they would come to Athena and not Epic because we would have an open API that would be easy to, instead of like, oh, come to the user conference and tell us, use your clout to get the customization of the screen and the button that you want. from Athena, which is sort of the traditional model of software customization, to just say, hey, write your own, here's the API, like, do whatever you want. Go get some React developers and do whatever you want. And that idea was a lot of work because Athena was written in Perl starting in 1999, and it was a little crappy in there. So anyway, that was canceled, and Athena became an extremely profitable company in a very short period of time. And the opportunity to build that for people existed. So Zeus doesn't sell to doctors or hospitals or plans. We sell to builders, people who can practice medicine and write code or can't practice medicine. We actually, weirdly, have now 2 EHR companies as customers who have said, I don't just want to be a SaaS company, I want to be there's got to be a better word than SaaS, but software and data as a service. Right? I don't want to start again, hey, I've got my new EMR now and it's all empty. So now I got to download from the old world or type it in or send a new member survey questionnaire, smoker, all the crap you have to do to get the data into your silo. What if there was a silo-less? What if there was a common repository that you could then write code against? And so that's what we're focused on, is the coalition of companies who actually do better in a really, really liquid, really, really slick federation of data. And we give away the software, like the APIs to do the view or do the questionnaire and all that shit stuff you can have for free or write your own or buy one of the companies that are connected.
You've written for Techonomy a number of articles, which we love. One of them was about how the EMR is a mess and can't really be used for what it's meant for.
I actually wrote the thing about, you're right.
Yeah, and you also wrote another article in 2014 where you said, healthcare IT systems exist as information islands disconnected from the world beyond their walls. Is that is that still true?
Absolutely.
Oh, damn it.
Absolutely.
8
lots
years
of
later.
Legislation, but what I think but as they said in Flight of the Conchords, conditions are perfect. There's now law. There's not just provider-based law, but consumer-based law, the Cures Act. There's a legal framework for channeling in and getting it, and they can't say no. But more importantly, there's actually a class of company, personally preferential to Firefly among them, but for obvious reasons, that actually have a profitable, growing commercial use of shared data. They do better in a shared data world, whereas the traditional fee-for-service provider does worse in a shared data world. And they still share data, they're not jerks, these are people who've devoted their life to the improvement of life. But anyway, hospital systems don't suddenly light up when they can't redo a blood test.
Okay, Fay, how you guys use Zeus at Firefly, right? Sort of.
We're in early stages.
Because I think what you said on the
They are
prep
my
call,
worst customer.
I think you said they were the first. You said they were the first customer.
They were.
And you are also them.
I thought we'd run the
He's
table.
the chairman and she's the CEO.
I'm on the board of Zeus as well. So
Yeah, they're on the board.
There's lots of
Right. So okay, why?
I have to be
so
SOC 2 certified to serve Fay.
What would you like to see it do?
Getting there.
How about that?
No, but I think that the promise of Zeus and why we are excited about it is it does come down to the sharing. So it is the concept of part of Firefly, we have a hybrid network. And what this means, we have traditional physical facility partners, health systems, urgent cares, and then we have this whole class of other virtual condition-specific specialty partners. So for GI, for MSK, this growing number of other partners, BH, for example. What we want to be able to do is have all of them be able to write to the same care plan, to a shared record, to be able to share notes across all of these on the same platform. Zeus is really built to empower that. And so I think that that is one of the things that we're excited about. Right now, they're doing things for us. We actually have some people licensing our platform and using our platform for their patient relationship management system. And what they're helping to power today is essentially the record and the forms through that platform. So that's step one for Firefly and Zeus. But we're excited about it.
And Firefly's actually done a good, I didn't know there would be a Zeus. I started Zeus sitting in Firefly board meetings going, Jesus Christ, this is going to be a long putt if somebody doesn't, it's going to take more than the 13 developers, 20 developers that Firefly can fund. Firefly's done a brilliant job basically finding, much of their network is now individual specialists who will moonlight like a Boston coach driver who finds the Uber app, and it's like, I got a little time, maybe I'll grab a quick ride, and after a while it's like, this is a lot better. We've got, what is it, a cardiologist in Paris who's just on the Firefly platform and does consults. So there is no data sharing. They just sort of become a gig specialist in the Firefly network.
That's less Zeus. That's not where.
That's not
Zeus.
my point.
So
Believe
those
me,
individuals
I
are
wasn't
on
gonna
Firefly
take a niche.
platform. I think the Zeus is where there's other virtual specialty
5
care
minutes.
partners.
We should give it all to Fay. Go ahead.
Keep going.
No, I was saying, dear.
Let's let David go.
Well, I wasn't sure what to ask next anyway, but so if Zeus really worked, or if you had what we really need is a record that you can write to, that you can search and apply efficiently in every situation, which the EMR did not become.
Amen.
That is really tragic. I mean, Epic made a shitload of money, but it did not become something you could write an API to and just like find out what you need about a patient, right?
So, and in fact, that is not what Epic's customers wanted. Epic's customers wanted to civilize their physician community, meaning make consistent in workflow choices their physician community, for better and for worse.
Payment. I mean, that's the thing. That's the thing that kills me about the EMR history is how much it's ended up being a payment system.
It's all about the codes.
It was all built. I mean, it was built for a fee-for-service system, built for claims, built for billing.
Blame not the bird of prey for eating the lamb.
Okay, what? Okay.
I mean,
I'm not
her
good
job
at
was to get
when I'm on
hospitals
stage.
to get the doctors to obey and get the billing up, and she crushed it.
We're talking with Judy at this point?
I mean, I tried, but she crushed.
She crushed it. But the point is, what we need is something we still don't have.
Right.
But you guys seem confident we are going to get there.
She's eating the lamb, but we're all vegan now because we've learned what lamb meat will do to you. So there's a whole new frontier.
On the prep call, I said to Fay, is he talking metaphors all day long at home too?
Yeah.
He does. And I was asking what the dinner table conversations are like. Are they about healthcare, Fay?
Usually not.
No.
No.
And you guys have
They're
seven kids,
care,
right?
Yeah.
They also have 7 kids.
Yeah.
How about that?
Well,
and look at how productive they are. How do you do that?
We kicked
Chaos.
5 of them out of the house.
Okay, that helps.
Yeah. They come back for breaks and Thanksgiving.
Okay, they're older, but still, I mean, the family that innovates together. I don't know. I can't finish the sentence. You could, but
we have a lot of electricity, and that's mostly good. I think that it's fun to have something to work on. We're not. Well, I guess we did redecorate a house together, but this is sort of a more lasting, heavy-duty, shared endeavor, and that does kind of get you through the rough patches of being bored of each other.
Since I called you the first family of digital healthcare innovation, why don't you each sort of wrap up by characterizing what you would say is the current state of digital healthcare innovation in the United States, and what would you like to see most that isn't happening yet?
I think that we have gone through an incredible boom and flourishing of what you like to call focus factories, these individual condition-specific companies. And I think that has been incredible in many respects, but I think that right now we've sort of gone past that and we're reaching a point of overwhelm, both in terms of individual members, in terms of employers, buyers, carriers, and we're really getting to a point of more consolidation. I think that people want more simplicity in terms of how they're accessing and being guided to and figuring out which of these dozens of solutions that they need at any given point in time. So I think that we're reaching a point of we've gone through a boom, a flourish, acceptance. And now it's about what does it mean to actually reach these in a consolidated fashion. So I think that we are seeing more consolidation, and we're seeing it across. We're seeing it everywhere.
But it's not going to be consolidation under Google or Amazon.
I think it will be in pockets. I hope that is not where it is, but I think that we're seeing people wanting to have more simplicity in a single stack versus having to navigate hundreds of solutions. There's 10 different MSK solutions, 15 different BH solutions. I think that they want to have that access point.
Well, that was a very specific and very useful answer. What are you going to say?
I'm going to say that digital health is Wesley but he is not yet the Dread Pirate Roberts. You know, he wins a lot of battles. You know, you did a great job today, Wesley, but I may kill you tomorrow. Princess Bride? No? Anybody? Thank you. And I think Wesley will become the Dread Pirate Roberts when the work that Fay is leading and others pulls through and the economic circle is closed, where the actual savings to the consumer and profitability of this always-on layer both turn green. And you see them flicker here and there. You see great clinical results, great consumer engagement, great growth. But those last two needles aren't all green. And the ones that get those green will be the Dread Pirate Roberts, and whoever owns them will have the opportunity to be a mega. And be they that we can complain about later on, and we'll have a new innovation crowd, a new Wesley. But that's where I think we are, is we're Wesley, not yet Dread Pirate.
But I'd say you're really the first family of healthcare optimism. That's where and I like that, and we need that. And your energy is spectacular and super welcome.
I like relentlessness.
Relentless is true too. Relentless also. So thank you so much. I wish Drew had given us an hour for this, but it's really great to have you both, and thank you. And do it again with us.